and welcome to Business Success in a Virtual World podcast, a resource of information for businesses to understand and embrace the innovative power of XR, VR, and AR. Each episode, we attempt to summarize what's new in this growing industry and highlight actual case studies of how these technologies are advancing success in business and enterprise. I'm Tim Beharon, Chairman of Creative Strategies, and each episode I'm joined by Barton Goldenberg, President of ISM Inc. Together, we help our listeners navigate the ever-growing mountain of information and technologies impacting virtual worlds, the metaverse, augmented reality, spatial computing, etc. In addition to all the information presented in each episode, additional information can be found on our resource website, in which you'll discover news, products, and most significantly, over 175 actual case studies of businesses utilizing these inventive technologies. That website is found at www.ismguide.com. The XR Metaverse resource link is on that site. There you'll discover field service examples, training, customer service, manufacturing, and much, much more. It's a fast-growing and complex area destined to impact your business. Let us help you figure out the best strategies. Now, on to the next episode. This week, for our case study, we're going to take a look at a field that we haven't touched on yet, which is in the area of medical. Personally, I've been looking at the medical XR VR space for quite a while. I've been shown amazing examples of this in the process and under development over the last 5 years, and even sat through a VR session where they were training a heart surgeon students on actually how to do a heart surgery. And at that point, as I was watching that, I kept thinking, this is really going to have a major impact, especially the whole depth of technology that includes VR, AR, and XR in the world of medical. And so this week's case study, Barton is going to share with you one of the more significant ones with a company or group that has been using this actually for 10, 12 years. And probably, for all intents and purposes, are defining how you would do this. So Barton, tell us about this particular case study.
Well, thanks, Tim. And I think it's a great case study, and I think we can all learn a lot from it. And I think it's really going to provide great opportunity in the future for applying some of the technologies that we talk about. So it's all about a company called Mayo Clinic and how they're leading the way in the use of XR, VR, AR technologies in healthcare. And what I'd like to do is talk about how XR, VR, and AR are revolutionizing healthcare, particularly in two areas, medical training and patient care. So what I'd like to do today, I want to start with a big picture introduction about how these technologies are being used in healthcare. And then I'd like to move into what I consider to be a truly fascinating case study on how Mayo Clinic is pioneering the use of these technologies. So from an introductory perspective, in the last recent years, all of us have seen the healthcare industry witness a remarkable transformation through the integration of XR, VR, AR technologies. And what it's done is it ushered into a new era of medical training and patient care. So let's look at each of those separately. On the medical training side, as we all know, this is an essential aspect of producing competent and skilled healthcare professionals. And XR, VR, AR technologies have opened up novel avenues for all medical students, for residents, and for practicing physicians to enhance their training in what is now in a safe, a controlled, and an immersive environment. So let me give you a couple of examples of what I mean on the training side. They have virtual reality simulators that enable medical students to perform complex medical procedures virtually, or from a learning perspective. And these simulations range from laparoscopic surgeries to dental procedures. They allow learners to practice and refine their skills without any risk associated with real life surgery. If you go to the AR side, there are learning apps that have brought the study of human anatomy to life. So medical students use AR-enabled devices to view and interact with 3D anatomical models that are overlaid onto the physical body, thereby making learning much more engaging and memorable and driving better patient outcomes. And there are also AR healthcare applications that enable specialists to provide real-time virtual consultations to healthcare professionals that might live, for example, in remote or underserved areas. And what that does is it bridges the gap between medical expertise and patients that are in need, thereby enhancing healthcare access globally. So that's the area overview on the medical training side. Tremendous opportunity. And today, by the way, I have lots of friends that are in medical school. They're all learning these technologies. It's a part of the curriculum. It's how they're learning to be doctors for the rest of their lives. So in addition to the medical training, these XR and VR and AR technologies also are providing invaluable tools for diagnosis and treatment. So for example, in the area of surgical planning and navigation, these technologies are assisting surgeons to plan complex procedures with great precision. So you mentioned one yourself with the heart, Tim, but I want to talk about one about neurosurgeons who now view a 3D reconstruction of the the patient's brain before they actually perform the surgery. And what that does, it allows them to better navigate during the actual procedure, thereby reducing surgical risk and improving patient outcome. So one surgeon that I spoke to said that, the old way of doing neurosurgery would you take basically an x-ray of the brain, and you're getting a 2D dimension. And then you're doing your best to figure out exactly where in this case, it might be a tumor in the brain, where it sits, and how to get it out without doing too little or too much, which can do damage either way to the body. And what he told me was that today what they're doing is they do the 3D scan. They have a brain built with the CAD CAM technology. They overlay the 3D scan on the CAD CAM. They color code it. He puts on his AR and sometimes VR glasses, and he will actually then see exactly where the tumor is, where the roots are, how to get around the roots to make sure they get them all so the cancer doesn't grow back, but not to cut too much so you could do other damage to the person's brain. And so it's really amazing. And what he said to me is that whole new approach of 3D reconstructions of the patient's brain using the technologies, this is changing his surgical approach 24% of the time. So in other words, he actually changes how he's going to do the procedure based on these 3D immersive technology views. So it's really quite amazing. Now, I want to turn briefly in the overview to the area of patient care, which is at the heart of the healthcare industry. And once again, XR, VR, AR technologies have played a significant role in improving both patient experience and, as I've alluded to, patient outcomes. So for example, in pain management, some of the XR, VR, AR apps are being used to distract patients from pain and anxiety during a medical procedure, or sometimes even in advance of that procedure. And what you do is, by immersing the patients in a virtual world, the perception of pain can be reduced, leading to a more relaxed and comfortable patient experience, and also helpful to the doctors. So the University of Pennsylvania, which happens to be my alma mater, I'm on the Wharton School side, but the University of Pennsylvania is actually leading the way in patient management and distraction, especially comes to treating children with cancer. So what they're doing is they are fitting the children with headsets for VR. Sometimes it's games, sometimes it's relaxing, just things that they can see and do while they're thinking about and understanding the operation and during the operation and so forth. But it's been a tremendously valuable way of, as I've alluded to, bringing down patient anxiety and patient outcome. Now, XR, VR, and AR is also being utilized as a therapeutic tool for patients with mental health disorders, things like anxiety and PTSD and phobias. So there's this whole new area that's emerged as a result of this called exposure therapy, where trained therapists collaborate with patients in this controlled virtual environment to help them confront and manage fears more effectively. And again, I have so many great stories, but the one I'll just very briefly touch upon is a therapist that was having trouble working with a particular patient that couldn't express themselves well. And so they put them in a virtual environment and gave them two worlds, the top of the earth and below the earth. And the top of the earth was beautiful flowers and birds and trees and sunsets and water and so forth. And the bottom of the earth, below the earth, was hell and fire and demons and all the bad things. And the therapist worked with this individual working with VR glasses to talk about how he spends his life and what's important to him, etc. And it was an amazing story of this kid all his life who happened to be homosexual and couldn't talk about it. He didn't feel comfortable. So he lived in this unhappy world as a demon when everybody was presenting happiness to him, and he couldn't express that to his therapist, and he used this VR, and it was a tremendous breakthrough for him. And he's I happen to know the guy. He's a wonderful guy, and he's done very well in life. Anyhow, enough about an introduction in terms of both patient care and medical training. I want to now turn to this amazing story about Mayo Clinic, which builds on many of the things that I just talked about. So many of us know Mayo Clinic. It has its origins, believe it or not, in the 1880s, when two brothers, William and Charles Mayo, joined their father's general practice in Rochester, New York. Now, three essential things contributed to the creation of what is today the Mayo Clinic. First of all, a family of very ambitious doctors. Secondly, an order of Catholic sisters. And thirdly, the advent of hospital-based aseptic surgery. This was all new in the 1880s. What's unique about the Mayo Clinic is it's always been a physician-led organization, which the physicians feel leads to them being able to provide a better quality of care. Today, the Mayo Clinic is one of the world's most celebrated medical institutions. They have 5 campuses located in 3 states, Minnesota, Arizona, and Florida. The U.S. News and World Report ranks Mayo Clinic as the #1 hospital in the nation. And the Mayo Clinic is ranked #1 in more specialties than any other hospital in the nation. It's home to many of the most brilliant minds in medicine, in cutting-edge healthcare research, and in continuing innovation. It has 76,000 employees, including more than 4,000 research personnel. And they care for more than 1.4 million unique patients each year, coming not only from all 50 US states, but also from 130 countries around the world. Simply said, the Mayo Clinic is a true gem in the field of healthcare. Now, what impresses me the most about Mayo Clinic is their culture of innovation. Their universally renowned research and novel therapy that leverage their whopping $500 million annual research budget and their pioneering commitment to apply XR, VR, and AR technologies to benefit their patients. So let me share with you a few examples of how the Mayo Clinic is applying XR, VR, AR technologies that span medical training, strokes, orthopedic and spinal surgeries, and much more. So on the VR training side, for several years, Mayo Clinic physicians have been using VR headsets to train on new medical equipment. And what it does is it allows the physicians to be onboarded more quickly and to be able to use the equipment more effectively. And I actually talked with some of the incoming doctors that have joined Mayo Clinic recently. And again, all of them through medical school today are using and learning how to use VR training, etc. But what the Mayo Clinic does is it's mandating that these physicians put on the headsets for every piece of equipment they're going to be working on and work through a VR training of that particular piece of equipment. They even use it for the laboratory so that you can be in a virtual laboratory environment. It's your lab. It's what you actually will go into, but you're learning where all the instruments are and how they work. And there's all kinds of things you can do in an immersive and virtual world where they can try things and fail and break things and not be responsible before they actually then use the machine or get into the lab. And they found that to be the only way today to effectively train their physicians. So it's the way they do their training. So it's really quite interesting. Now we get to some interesting things. I just zoomed it up to the last couple of years because there's So many cool things they're doing. But in the beginning, in early 2022, so last year, they began developing their own VR software to improve neurological evaluation of stroke victims. You see, many of the patients, stroke victims, are not mobile. So it makes it difficult for the patients to come and see a neurologist in person. The goal of the VR software that they're developing or have developed is to augment telestroke examinations. So telestroke meaning, online, maybe in a Zoom meeting or whatever it may be, and enabling that person to do at-home monitoring, particularly for patients with chronic neurological conditions. So what happens is the patient wears a VR headset to perform periodic VR tests that are aimed at catching an early sign of progression or monitoring treatment or screening for abnormalities. And then if they see that, they obviously schedule either a telestroke examination, or if need be, they figure out a way to get that patient into a doctor's office, into a neurologist's office for whatever may be appropriate. So that's early 2022. Later in the year, and this is something the Mayo Clinic is very big on, they create a strategic partnership. They have lots of strategic partnerships. This one is with a company called Immersive Touch for orthopedic surgery. Now, Immersive Touch is a leading medical technology company that offers both VR and AR surgical planning and navigation platforms. And what Mayo Clinic does is they use the Immersive Touch AR platform to provide surgeons with what is called 3D holographic X-ray vision. And what it does is it goes through the skin and allows the surgeon to visualize a patient's specific anatomy, and in their case it's orthopedic, at various surgical phases, thereby helping the surgeons to navigate their instruments more accurately. So it's just a great example of leveraging the technology to do things they can't do in today's medical community without this 3D holographic X-ray vision through the skin. Let's bring it to the beginning of this year. In early 2023, Mayo Clinic announces a strategic partnership with another company called MediView XR. They're a leading clinical AR medtech company that displays 3D patient anatomy. And what Mayo Clinic surgeons do is they use the MediView AR technology to resolve a dilemma they all face, namely two-dimensional medical imaging limitations that lack the integration between, on the one hand, the medical images, and on the other hand, the location of the surgeon's tools. And what the 3D tools provide is real-time feedback so that the surgical instruments are in the proper anatomical location, and they inform the surgeon of potential immediate medical errors. And I referred to the neurosurgery that I talked about earlier. That's the tool that they use. So they're doing the 3D scans, they're putting them on top of the brain, and then they're using some of the MediView AR technology to actually bring the tools in. And while this is happening, they use the AR glasses, the surgeon, to actually scrape out the particular tumor, in this case a brain tumor, without damaging any of the other parts of the brain around it. It's very fascinating. Now, just go back to Mayo Clinic. Then just last month, in June 2023, Mayo Clinic partnered with another company called Surgical Theater, and they did that to assist with spinal surgeries. Now, spinal surgeries are in a very confined space. So what Mayo Clinic surgeons do is they use the Surgical Theater's AR tools to once again create a 3D model based on patient scans during the pre-operational phase. And then the surgeon uses these scans to see past tissues, past the bone, while using minimal invasive procedure to remove a tumor, or to make the decision that that particular patient needs to be cut open and they have to do some sort of an open surgery. What the scan also does, though, is it creates VR models, not AR that the surgeons are using, but VR models that allow patients to better understand the procedure. So they show the patient exactly how they're planning the surgery. They can see, inside their spinal cord and so forth, what's going on. They can understand what will be done, and that's another part of patient care. So that's just another example of how Mayo is partnering, in this case, with a surgical theater for spinal surgeries. What is refreshing to me is the pioneering spirit of Mayo Clinic. I find it both refreshing, Tim, and commendable as they continue to raise the bar on the art of the possible for applying XR, VR, AR technology in healthcare. And when you got a budget of $500 million for research, and you have a group of doctors, a clinic, a 5-location clinic that is led by doctors who are committed to using whatever tools they can to better the patient, you are creating an environment for innovation, for entrepreneurship, for trial and error, and all of these things come into play given today's XR, VR, AR technology that are being used in healthcare. So in closing, we could spend time talking about high-end XR, VR equipment is costly and therefore limited to certain healthcare facilities. And that's a true issue. But over time, costs will come down, and over time, hopefully, money will be raised to bring in these types of technologies to all facilities, regardless of how big or small they may be. And we could spend time talking about patient data privacy and security issues using, XR, VR, AR technologies, and that does remain a concern. But that will get better. And Tim, you're working, as you're quite knowledgeable about this and working with others that are creating some of the standards for this. But the bottom line is the integration of XR, VR, and AR technology has truly reshaped the healthcare landscape. It's revolutionized medical training. I mean, there isn't a graduate from medical school who doesn't learn that type of training, VR training and AR training, and isn't brought into hospitals in that way for leading research institutes, and also improving patient care experiences, both by pre-operation, during operation, and post-operation, sharing with the patient what they're going to do, what was done, and how it worked and how it's healing. So from enhancing medical education and training to offering innovative solutions for diagnosis and treatment, XR, VR, AR technologies continue to drive advancements in healthcare. And as these technologies evolve, healthcare professionals and we as patients can look forward to a future where medical practices are safer, they're more efficient, and more patient-centered than ever before. And that's what I wanted to share, Tim, about the Mayo Clinic today.
As you describe especially the pioneering spirit of Mayo, that actually has been a part of their heritage. They have done some of the greatest medical research in history that's benefiting everybody. But the fact that they've gotten a very strong dose of understanding the role potentially of the VR headsets and MR headsets, etc., and then are already finding partners to implement it in various aspects, not only for training, but for patients and monitoring, is absolutely an amazing thing based on the fact that, even though AR and XR has been around for and VR specifically been around for 20, 25 years, it's getting to the point now, and especially since Apple has brought this to the forefront with the Vision Pro, this is now becoming a much more focused center that every industry has to look at. It's not just the Mayo Clinic, but every industry who needs to stay innovative and more importantly, competitive, are going to have to deal with this question of how can I utilize something like the Vision Pro or any of the other headsets in order to not only innovate, but to keep ahead of my competition. And the medical one is just absolutely amazing because what they've already established. Can you imagine what they're going to do 3 years from now? And I was thinking as you were talking, I go, what can you even imagine once they get access to Apple's Vision Pro?
And well, that's what I want to talk. I want to ask you this question. So all of you know that Tim was one of the very few analysts that was invited to the Apple campus when they launched on June 5th, the Apple Vision Pro, and he saw some amazing things. And I just want to ask this question because I have a fairly good understanding of the answer, but I want you to kind of lay it out for our listeners. So the Vision Pro is an actual headset. It's largely AR, but also VR capable. And it is, as you will explain, incredibly technologically advanced in 3D. So you're actually inside the heart or inside the spine or inside the brain, etc. And now they're creating the Vision Pro App Store, and they've released the SDK, the software development kit. So I just wonder, how will Apple Vision Pro, with medical apps that can be used and purchased in a store, in the App Store, how is this going to revolutionize healthcare?
Well, in this particular case, I think it's less that the apps are in the App Store. What'll happen is the example that Mayo already had, where they went out and had a special company that they worked with that had, in this case, it was both hardware and software to do a particular feat. It's going to be the same here. What's going to happen is the medical community, especially ones who are doing specialized software for medicine, that does everything from simulation to execution, they're going to begin creating on the Vision Pro platform, and then they will go to the medical community. And these particular apps probably won't be on the App Store per se, not in the sense of the way they would be promoted. They may be there for download, but what'll happen is the medical community and those who are creating those type of apps will actually have their own section, and they will then promote that to the Mayo clinics and the San Francisco clinics, etc. And then they will go to the App Store to download it. It's going to be a completely different way of how you actually market, at least in this particular market. But the bottom line is Apple's going to make it pretty easy to gain access to it. And again, when I put the headset on and I started using it, first of all, I was in awe of what I saw because, as you said, I was in the moment. I was at the game. I was at the medical event, etc. But one thing that I've learned after 40 years in the computer industry is that the technology is really more of a gateway to innovation. And what we'll see happen is the software community go bananas, and they're going to create things that you and I can't even imagine today. It's going to be in every sector. It's going to be medical, oil, communications. I mean, tell you, it's the most exciting thing I have run across in my 40-year career because of the potential impact it's going to have on everybody's lives. But the emphasis on medical, especially now that I'm becoming an old person, it's very clear that as I get age-related stresses and aches and pains, etc., I wouldn't mind some pain distraction in VR.
Well, I want to go back to just the two things you've said and kind of erased. Just the fact that the neurosurgeon, and by the way, he's in Orange County in California. That's my friend. He 24% of the time he changes his planned surgery based on the 3D imaging that he overlays on the brain that's already been built in CAD, and actually will change how he's going to do the surgery. And then it's what is amazing is the color coding of the scan. It comes in green and orange and yellow and red, and he knows that you can touch green and red but not orange and yellow or whatever it may be. So it really improves the surgery. So that's one thing I find it just amazing. So 1 out of every 4 times he changes the way he would have done the surgery. And as we learn more and as the technology gets better and as Vision Pro, he can wear those headsets, he can even get more precise and better scanning. And so we're going to really improve medicine. I think that's really cool. I think the other thing that you hit upon, not so much your age, but all of us become more conscious of medical challenges as we get older. What is it? What does it mean? Am I going to be okay? How long is it going to last? So we want to learn. And one of the most amazing things now is pre-operative or whatever, during and post-operative explanation and understanding. And so this ability, I mentioned the Children of Cancer in University of Pennsylvania and else some of the other things that are being done, but the ability to explain exactly what's going to happen, to put us at ease, to explain what we did during the surgery or during the operation so that we can see what was changed in our body, and the ability afterwards to then revisit it through, again, 3D scanning and putting on a set of goggles to see exactly how things are healing and not healing. It changes the way we feel about medicine and ourselves and the interaction we have with our doctors. You know, I'm doing a little bit of research on something completely different, and that's the consumer goods packaging industry. And the question that's being asked in that packaging industry is, if a product could talk, what would it say? Because consumers want to put on goggles and learn the whole history of the company and the wine fields or the oil refineries or whatever. Think about it in a medical perspective. You know, if I could learn about my surgery or my upcoming so-and-so or my health, what would I learn? What would it say to me? And so it opens up a whole new spectrum of learning about ourselves and using the technology to be, you know, at ease, to feel more comfortable, and allows the doctor to do a much better job at both the surgical side, the post-surgical, and even the pre-surgical preparation. It's an amazing time, Tim, for our industry.
Yeah. Well, we've ran out of time for this week, and I'd like to thank all of you for joining us.
Thanks, Tim, and thanks, everybody.
For more information on this and other case studies, please check out the website www.ismguide.com and click the link for XR Metaverse Resource Center. We look forward to you joining us next time on another episode of Business Success in a Virtual World.